This page is dedicated to discussing how the condition cerebral cavernous malformation will appear on radiological imaging. This particular condition goes by a lot of different names, but we're going to refer to it as cavernous malformation for the purposes of this page. The point of these condition-specific radiology pages that I have on my website are to enable you to look at all of the relevant imaging for a particular condition in one place. And also, the point of these pages is to organize the imaging by modality. All the CT scans are in one place, all the different MRI sequences are in one place. We'll see a little bit more exactly how that plays out when we scroll through the page. But to start, for this particular condition, we want to just appreciate fundamentally what its base pathology is. It is a vascular malformation that occurs in the brain. And really, these cavernous malformations are these collections of dilated, thin-walled capillaries that aggregate in this clustered format. So as we're thinking about what this is going to look like on imaging, we want to appreciate that we're going to have this clustered appearance, sometimes called a popcorn or berry lesion. And also, we want to also understand that there oftentimes is a collection of hemosiderin around the outside of the lesion, which can give us imaging artifacts. So as we look at what we have on the page, I just kind of explain a few of the general radiological features that we discussed that kind of carry through all modalities, and then we break it down by specific modalities. So if you're thinking about how in real life, in a clinical context, these conditions are going to appear and how the patient is going to come to realize that they have this diagnosis, we want to appreciate that a lot of patients are getting non-contrast head CT scans, and I have an example, actually many examples in one place, of how these malformations appear on this imaging modality. So again, we want to keep in mind that for a non-contrast head CT scan, the appearance can be variable. If the lesion is dense enough, you may see a signal. Also, if the lesion is actively bleeding or has recently bled, edema or blood can also show up on a non-contrast head CT. But what you really want to keep in mind is that it can have a very variable appearance. So for this particular example, you can see it very clearly. It's a very large lesion on the different views. However, here it's a little bit more subtle, and here it looks a little bit more subtle, different appearance, and here it's very difficult to appreciate. So this is the area of a known malformation that doesn't really show up as brightly as some of the other examples. So the examples I have here in this gallery kind of help illustrate the range of pathology you can see on a non-contrast head CT. And then in cases where the lesion is actively bleeding, like this one, it becomes much more obvious again. So that's just one example. The other thing that we can do is look at some of the MRI sequences. Now, this particular gallery is dedicated to susceptibility sequences, and these demonstrate this artifact that shows up with the hemosiderin deposition in these lesions. So what I want you to appreciate is that these are our susceptibility sequences, either GRE or SWI. These are our T2s on the right, and we can just click through this gallery and see again and again how we have the susceptibility artifact on the left that corresponds to our malformation on the right. And this may be one of the first things when you're looking at an MRI, you may notice that you just have this susceptibility artifact that is pretty much universally seen with cavernous malformations. And again, this is a great gallery to just show you all the different examples and kind of reinforce how common it is to see this artifact with this particular condition. The last thing I want to quickly discuss is the T2 weighted imaging. It's not the only thing you're going to look at when you're reading your MRIs, but it's perhaps the best sequence to appreciate the classic appearance of this cavernous malformation. Now, we know from our diagram before that it's the clustered appearance that we're looking for, and this is a classic berry lesion or popcorn lesion where these are the clusters of dilated capillaries. They're T2 bright, and they have this dark ring around them that corresponds to the hemosiderin that we talked about before. And these are best appreciated on T2. So this classic T2 bright, dark ring, popcorn berry appearance is something that you can see in all the examples in this gallery that kind of reinforce these classic patterns that are seen in cavernous malformation that really help make the diagnosis. So there are other MRI sequences and CT galleries that are present on this page. Feel free to click through them and to see the range of pathology for this particular condition, and hopefully this will help you in identifying cavernous malformation in the future.